Hi everyone, I'm Dr. Ramya G. Gowda, Senior Fertility Consultant at Cloudnine Group of Hospitals, Bangalore and Sarjapur Road, Bangalore. When it comes to the periods, ideally if we look into the female reproductive system, every woman should get a cyclical period pattern in which there are multiple changes happening in her body. So in the ovary, follicle will be developing and the ovulation will be happening, and in the uterine lining, that is inner layer of the uterus, the endometrium starts building up, and once the ovulation happens and if it doesn't result in a pregnancy, then this endometrium starts shedding as a menstrual flow. So for the cyclical pattern of the shedding of the endometrium is called menstruation or the periods. In case if it is not cyclical, that means the ovulation is not happening naturally. There might be multiple reasons for that, probably some hormonal imbalance, excess weight gain, or certain general conditions like thyroid disorders or the prolactin disorders, or coexisting other medical illnesses like diabetes, hypertension, or any chronic ailments, or the reproductive system related disorders like polycystic ovarian diseases or poor ovarian reserve or endometriosis. There are multiple conditions in which there might not be a cyclical pattern of the periods. If the period is not cyclical, then it is always better to consult the expert and to identify the underlying cause. The treatment of the underlying cause helps in preventing the further complication of irregular periods, and also it helps in getting pregnant, because once the underlying cause, most of the time it will be anovulatory. That means the egg might not be releasing in time. That might be resulting in irregular periods. So if we treat the underlying cause with the help of an expert, then it will help you. And also if the general lifestyle modification, like if there is obesity, then we have to shed the weight and ideal body mass index has to be maintained. And then if there is other conditions like diabetes, the blood sugar should be well controlled. If there is a thyroid disorders, the thyroid level has to be well controlled. If the prolactin levels are high, then the ideal treatment has to be taken. So these are the things which helps in correcting your cycle, because it's not only about shedding your endometrium periodically. If the periodically endometrium is not shed, definitely there is a disordered ovulation, and if it is not treated timely, then it might result in infertility.